Understanding blood pressure. A key to cardiovascular health. Each time a doctor measures your blood pressure, they're actually assessing the pressure of blood flow against the walls of your arteries within the circulatory system. Blood pressure is one of the most vital indicators of cardiovascular health and directly impacts your entire body. This pressure is primarily created by the heart's contractions, which propel blood throughout the body. Through blood pressure readings, doctors not only evaluate the intensity and rhythm of the heart's activity but also analyze the elasticity and size of the arteries. When you receive your results, you'll see two numbers. Checkmarked systolic blood pressure, the higher value, measured when the heart contracts and pushes blood into the arteries. This is when the pressure is at its peak. Checkmarked diastolic blood pressure, the lower value, recorded when the heart is at rest between beats, when the pressure is at its lowest point. Below are blood pressure charts recognized by medical experts as ideal levels for both men and women. Based on age, for older adults, blood pressure goals are adjusted accordingly. These charts will appear on screen for your detailed review. According to recommendations from the American College of Cardiology and the American Heart Association, individuals aged 65 and older should aim for a blood pressure below 130/80ths of a millimeter of mercury to reduce the risk of health complications. Hypertension, also known as high blood pressure, is a silent threat that can lead to a range of serious problems like heart disease, stroke, and kidney failure if not controlled in time. Blood pressure is one of the most crucial indicators reflecting cardiovascular health. Among these, systolic blood pressure is the highest pressure that blood exerts on the artery walls when the heart contracts and pushes blood throughout the body. But what happens when blood pressure remains elevated for an extended period? This is when the body sends warning signals about a serious problem. Hypertension, also known as high blood pressure. Hypertension occurs when the pressure of blood in the arteries consistently remains above normal levels. When this condition persists without being controlled, it can cause serious damage to the cardiovascular system and many other organs in the body. Did you know that hypertension is one of the leading causes of checkmark stroke? When blood pressure is too high, the artery walls can be damaged or even rupture, causing a potentially dangerous brain hemorrhage. Checkmark heart failure. The heart must work excessively to pump blood through narrowed arteries, leading to weakening and loss of function over time. Checkmark chronic kidney disease. High pressure can damage the blood filtering system in the kidneys, causing a serious decline in kidney function. Checkmark vision loss. High blood pressure can damage the small blood vessels in the eyes, affecting vision and even causing blindness. Even more frightening, high blood pressure often has no obvious signs in its early stages. This is why it's known as the silent killer. Hypertension doesn't always have a specific cause. However, medical experts divide it into two main groups. Red circle primary, essential hypertension. Checkmark usually develops slowly over time, with no identifiable cause. Checkmark often related to genetic factors and the body's aging process. Orange circle secondary hypertension. Checkmark stems from an existing underlying condition, such as chronic kidney disease, endocrine disorders, diabetes, or cardiovascular problems. Checkmark can be a side effect of certain medications like birth control pills, pain relievers, or anti-inflammatory drugs. Checkmark certain unhealthy habits can also lead to high blood pressure. So, what factors increase the risk of developing the condition? Take a look at the list below. If you find yourself having more than one factor, it's time to proactively protect your health. Revolving light risk factors for hypertension. Checkmark high salt, saturated fat diet, processed foods, fast food, and red meat can cause blood pressure to rise. Checkmark lack of physical activity, sitting for extended periods, not exercising, leads to poor blood circulation, increasing the risk of arteriosclerosis, hardening of the arteries. Checkmark smoking, alcohol consumption. Nicotine in cigarettes and alcohol cause blood vessel constriction, leading to a sudden increase in blood pressure. Checkmark prolonged stress. When you're stressed, the body produces hormones that make the heart beat faster and blood pressure rise. Checkmark overweight, obesity. Excess weight puts more pressure on the artery walls, forcing the heart to work harder. Checkmark age. As you get older, Artery walls become less elastic, making them more susceptible to damage from high blood pressure. Are you in the risk group? If so, take proactive steps to adjust your lifestyle today to avoid unfortunate consequences later on. How to recognize high blood pressure. One of the most dangerous things about hypertension is that it often has no clear symptoms. Many people only discover they have high blood pressure during a medical checkup or when they experience a serious complication. However, if blood pressure rises too high suddenly, the body may signal through some of the following signs. Warning symptoms of high blood pressure. Checkmark severe headache. A feeling of tightness, especially in the back of the neck or temples. Checkmark dizziness, lightheadedness, a sensation of unsteadiness. Loss of balance, especially when standing up suddenly. Checkmark chest pain, shortness of breath. The heart works harder to pump blood through narrowed arteries, causing chest tightness. Checkmark rapid heartbeat, palpitations. Heart rhythm may become irregular when blood pressure spikes. Checkmark nausea or excessive fatigue, when blood pressure is too high. The brain doesn't receive enough oxygen, causing a feeling of sluggishness and loss of energy. If you experience any of the above signs, check your blood pressure immediately and seek medical advice for timely treatment. So the advice for you here is, don't wait until you have symptoms to check your blood pressure. Make it a habit to measure your blood pressure regularly, especially if you have risk factors. Small diamond: maintain a healthy diet, exercise regularly, and manage stress to keep blood pressure stable. Small diamond: stay away from alcohol, tobacco, and bad habits that negatively affect blood pressure. Small diamond: when blood pressure is too high or there are abnormal symptoms, seek medical assistance immediately. You can control your blood pressure today. Take proactive action to protect your heart and your health. Besides high blood pressure, another condition that can seriously affect cardiovascular health is low blood pressure. This is a state where the pressure of blood in the arteries falls below normal levels, usually defined when blood pressure is below 90/60ths of a millimeter of mercury. Low blood pressure can prevent the body from receiving enough blood and oxygen, especially affecting the brain, heart, kidneys, and other important organs. If not controlled in time, low blood pressure can cause dizziness, fainting, and even be life-threatening in some severe cases. So, what causes this condition, and how do you recognize the warning signs? Let's find out. There are many factors that can cause blood pressure to drop too low, including underlying health issues and the effects of daily lifestyle. Stethoscope: some common causes of low blood pressure. Checkmark severe dehydration, when the body becomes dehydrated due to diarrhea, vomiting, or excessive sweating. The amount of blood in the circulatory system is reduced, leading to a drop in blood pressure. Checkmark conditions related to the heart and endocrine system, people with cardiovascular disease, hypothyroidism, or diabetes are at high risk of low blood pressure due to the ineffective functioning of the circulatory system. Checkmark anemia, malnutrition, when the body doesn't have enough iron, vitamin B12, or folic acid. Red blood cell production is impaired, leading to anemia and causing low blood pressure. Checkmark side effects of some medications. Some medications for treating hypertension, depression, or Parkinson's disease can cause excessive vasodilation, causing a sudden drop in blood pressure. Checkmark orthostatic hypotension. This is a condition where blood pressure drops rapidly when standing up suddenly after sitting or lying down for a long time, causing dizziness and lightheadedness. Checkmark excessive stress. Prolonged stress can disrupt the function of the autonomic nervous system, affecting blood pressure. Low blood pressure can cause many unpleasant symptoms, affecting daily activities and quality of life. When blood pressure drops excessively, you may experience the following manifestations. Warning: typical signs of low blood pressure. Checkmark dizziness, lightheadedness, a feeling of loss of balance, especially when standing up suddenly. Checkmark fatigue, sluggishness. The body lacks energy and easily feels exhausted even without much physical activity. Checkmark pale, cold, and clammy skin. When blood circulation is poor, the skin becomes pale, cold, and feels clammy. Checkmark fainting. If blood pressure drops suddenly, the brain doesn't receive enough oxygen, which can cause temporary loss of consciousness. Checkmark visual disturbances, blurred vision, double vision, or a feeling of floaters in front of the eyes when changing positions. If you frequently experience these symptoms, monitor your blood pressure and seek advice from a doctor for appropriate treatment. Whether high blood pressure or low blood pressure, the most important thing is to maintain blood pressure within a safe range, helping the cardiovascular system to function well and prevent serious health problems. Here are effective measures to help you control blood pressure naturally and sustainably. How to control high blood pressure. Pushpin. If you are experiencing problems with high blood pressure, apply the following measures. Checkmark. Limit salt and saturated fat. Reduce consumption of salt, processed foods, and fried foods to avoid increasing blood pressure. Checkmark. Increase green vegetables and potassium-rich foods. Bananas, oranges, sweet potatoes, and leafy greens help lower blood pressure naturally. Checkmark. Exercise regularly. Exercising for at least 30 minutes a day helps improve circulation and keep blood pressure stable. Checkmark. Control stress. Practice meditation, yoga, or deep breathing to help the body relax and lower blood pressure. Checkmark. Limit alcohol. Quit smoking. Stimulants can constrict blood vessels and increase pressure on artery walls. Checkmark. Maintain a healthy weight. Lose weight if you are overweight to reduce pressure on the cardiovascular system. Checkmark. Use medication as directed by your doctor, if you are prescribed medication. Adhere to the correct dosage and treatment time. How to improve low blood pressure. Pushpin. If you often have low blood pressure, try the following ways to improve this condition. Checkmark. Drink enough water. Ensure adequate water supply to the body, especially on hot days or when exercising a lot. Checkmark. Increase salt moderately. Unlike people with high blood pressure, people with low blood pressure may slightly increase the amount of salt in their diet as directed by their doctor. Checkmark. Eat a nutritious diet. Supplement with foods rich in iron, vitamin B12, and protein to prevent anemia and maintain stable blood pressure. Checkmark. Avoid sudden changes in position when waking up or standing up. Do it slowly to avoid dizziness. Checkmark. Eat small meals. Eating multiple small meals throughout the day helps the body maintain stable energy levels, preventing drops in blood pressure after eating. Checkmark. Use medication if needed. If low blood pressure is seriously affecting your life, your doctor may prescribe some support medications. Measure your blood pressure regularly, especially if you have a history of cardiovascular disease or have abnormal symptoms. Small diamond. Build a healthy lifestyle, combining a balanced diet, regular exercise, and adequate sleep. Small diamond. Do not take blood pressure medication without consulting a doctor. Small diamond. When there are signs of blood pressure being too high or too low, seek medical assistance immediately. Pushpin. Controlling blood pressure not only helps you avoid the risk of stroke and heart attack but also brings a healthy and energetic life. Have you checked your blood pressure today? If not, start monitoring it now. Rocket. Blood pressure is an important indicator that reflects the condition of your cardiovascular health. Whether it is high blood pressure or low blood pressure, monitoring and controlling it properly will help you avoid dangerous complications and maintain a healthy, energetic life. If you find the information in the video helpful, please leave your comments in the comment section below. We look forward to receiving your sharing, questions, or experiences on how to control blood pressure effectively. Right finger. Don't forget to click like and subscribe to the Health and Life channel to not miss useful videos about health. Let's build a healthier community together every day. Turn on the notification bell to receive the latest updates from us. Thank you for watching. See you in the next videos. Blue Heart Rocket.